All right. Welcome and thank you for joining. My name is Ashley Lusick, and I am a health educator for community health at Atlantic Health System. Today's webinar, ER Urgent Care or New Advanced Urgent Care, Where to Go When You Need Help Quickly, is presented by Dr. Michael Girardi. Before we begin, I have a few announcements. This webinar is being recorded. All participants are muted. If you have a question, please use the Q&A for questions or the chat for comments. We will try and get through all questions at the end of this presentation. Are you or a loved one interested in smoking cessation? Atlantic Health System offers a free quit smoking program. This program includes an individual assessment, free nicotine replacement products, and 6 weekly group meetings to help you quit and stay smoke-free. There are multiple dates and times available, with groups available in person or virtually. For more information about these groups and other resources, or for additional dates and times, please call 1-844-472-8499. Did you know that your mental health impacts your overall well-being? During Mental Health Awareness Month, let's focus on loving kindness, a simple yet powerful practice that nurtures compassion for ourselves and others. Visit atlantichealth.org/grow for mental health resources and activities for all ages. And I am now going to turn it over to Dr. Girardi.
Well, good evening, everybody. My name is Mike Girardi. I'm an emergency physician, and actually I've been practicing medicine for almost 40 years as an emergency physician at Morristown Medical Center, faculty there. But my life's been really exciting the last few years because we have these new centers we've set up and constructed that give you an option from going to the emergency department. So what we're going to talk about today is, when do you go to your primary care doctor? When can you go to walk-in? When can you go to urgent care? And finally, these new advanced urgent cares that are functioning like emergency departments, but they're a little bit different. But you'll be really, I think, pleasantly surprised at what's available to you through Atlantic Health. Once again, I'm a faculty and I'm one of the chief medical officers. So we're going to talk about the extremes of age today as well. We're going to talk about children, and we're going to talk about your parents. Some of you are in the sandwich generation, and the ages we will see people. I'll tell you right now, 0 age infants to 105 and older. I took care of a 106-year-old a couple of months ago at one of our advanced urgent care. So some of these things, all of a sudden back pain. They're probably not going to see the gentleman in the upper left in an urgent care, but he would think to go to the emergency department right away, but he doesn't need to. He can come to us. The woman who fell, she's got a little bump on her nose. She fell and hit her head, may need a head CT, and she has a broken bone. We splint, stabilize, and bypass the ED altogether. So that's you. You're worried. You're a parent. You're a daughter or son, and I have an elderly parent. What do I do when there's somebody's not feeling well? You know, my dad is where do I go? Are there any options besides the emergency department? Because I know that there's a phobia of emergency departments since COVID. So these are what we're going to talk about today. Walk-in clinics, urgent cares, specialty urgent cares are also available. We'll mention them quickly. Advanced urgent cares, what the folks will be at the end of the discussion. And then the emergency departments as well. There's no replacements for emergency departments for many things, and we'll talk about all that. This is back from almost 20 years ago, the cover of Time magazine. Our emergency departments are in crisis. There's such great demand on the hospitals and the access to healthcare that our EDs, no doubt, are crowded. Not so much from the ED volume, but because the hospitals are full, it backs down and people can live in stretchers in the ED for days sometimes. And it's unfortunate, but we're expanding our capacity every day in the United States because of the increasing demand on services. And this is what does change access to medical care. There's numerous things that happened in the last couple of years. Upper left is the coronavirus. You know about that. Plus last year, the triple-demic. Again, this year we had RSV, influenza, and SARS-CoV. So it just in December, January, February, boom, the demand is really quite incredible. And that lower left is a picture of many emergency departments in our country right now. You don't get a private room unless you have like really contagious disease or they try to get you out of there. But and then the other thing, we really, that lower left is suboptimal, but I'm going to give you options to that. And we've had the great resignation, we call it. Many people got close to retirement and said, oh, I can't, that COVID really changed my whole outlook on life. And so I know that you're having a tough time for access to care. And that's one of the reasons we're having this webinar tonight. So you have an unexpected illness or trauma. They're out of the blue. They come in the middle of the night. You have severe abdominal pain. You trip down a flight of stairs. You think you broke your ankle. Your child twisted an ankle at a soccer game. You're watching the grandchild and they spike a fever. Oh my God, you feel like it's your fault. It's not. Your grandchild won't move her arm after playing on the monkey bars. You have chest pain yourself, or you feel short of breath. Where do you go? And so, and your doctor's closed, so they really can't give you advice. So what drives your decision where you're going? Well, is it medical or is it traumatic? If you really had a bad car accident, EMS is going to take you to the hospital. But if you're driving yourself, you do have many, many options. And your primary care physician may actually see you as well for many. They all have different capacities and you have to talk to them. What time of day is it? Is it 10 in the morning or is it 7 o'clock, the bewitching hour? Everything seems to be closing. Where do you live? How far of a drive is it for you? And can you drive safely? Or do you need to call EMS? Let's say there's one of your loved ones is bleeding. Can you hold pressure on it and drive at the same time? Maybe not. So these are all things that you think about ahead of time. So when you call your primary care doctor, usually they're pretty good about getting you in. They have sick call hours, They're familiar with your health history. They know which treatments have worked for you in the past, especially if you're asthmatic or you have emphysema or you have abdominal pain or irritable bowel. And they know how to take everything into consideration. Urgent care clinics and EDs are not a substitute for your primary care physician. And by the way, I can tell you this right now, Atlantic Health urgent cares do not keep patients as primary care patients. They always send them back to their primary care physician. Now, what's the difference between walk-in clinics and urgent cares and emergencies? Well, if you look at the second bullet, there's distinct differences based on the level of care. The staff that are there, the nurses included, the equipment, and the medications. That we're going to talk about this evening. So walk-in clinics and urgent cares, well, they fill a vital gap when you come sick or injured because you need care today or by tomorrow morning. And the doctors are overwhelmed at times. You remember the Great Resignation, and people, they're short-staffed, and sometimes they just don't have the availability. Now, if you would feel good about going to your primary care and you can wait a day and you treat symptoms, that's fine. But sometimes you don't think you can wait. You have a trip to go on, you don't want to be contagious to other people, so you want to get tested immediately. So that's what these minute clinics are for. You see them in CVS, you see them in Walmart's, they're popping up. I think Walmart's actually going to shut down some of them, but you walk in, you get seen, you got a cold, you got a rapid strep test, your flu test, maybe, and you're on your way. So these visits tend to be not serious enough for emergency department or an urgent care. We'll talk about that in a second. It's fast. No, you walk in, and you're going to be usually seen by a nurse practitioner, a physician assistant, who are pretty experienced in all this stuff. So you have pain on urination. You treat us for UTI. You have rashes without a fever. Rashes with fever tend to be different than rashes without a fever. So just remember that. You have mild flu symptoms. You could read the list, pink eye. And sometimes some of them do sports physicals as well, but more urgent cares do sports physicals for your kids. And this is another walk-in clinic at Walgreens. You can see, you get familiar with that. Now, when you go to an urgent care, that's another level of discomfort or illness and seriousness of your complaints. And you could have fever without a rash, a fever of vomiting or persistent diarrhea. We can get you symptomatic relief. Abdominal pain depends on the urgent care. They may say, see you later. You're going to the emergency department, but there's a gap between urgent care and emergency department we're going to talk about today. Wheezing or shortness of breath, they may send you on your way again, or they may treat you with a couple treatments. Dehydration, some urgent cares, but very few now do IV hydration. You've heard of IV hydration clinics, by the way. They're being touted for long flights, dehydration after too much night partying, all these different things. And anyway, I'm not even going to talk about them today. But anyway, moderate flu symptoms, sprains and strains, some have x-ray capability. You should always call ahead of time and see if they have an x-ray tech because there's a great shortage of x-ray techs right now. And this is what is urgent care. This is a Riverside, I think, and Optum and Atlantic Health has purchased more of these that are standing up as regular urgent cares. And this is the one up in Sparta. If any of you with us tonight live up by Sparta, it's on Route 15. Nice 7 or 8 bed facility. And we're trying to advance the care there as well to avoid having to go down to Morristown or Newton Hospital. There are specialty urgent cares. This is orthopedic one. This is what they look, the Orthopedic Institute of New Jersey has a couple of their own urgent cares. And pediatric urgent cares also existed. This is your kids' urgent care, but I think they got taken over by ACF, Acute Family Care, AFC, Acute Family Care is an urgent care, primary care type operation. And then this is a PM Pediatrics has been around for almost 20 years. And They're pretty good. They're usually staffed by a pediatrician or peds emergency physician. But now you look at this list of complaints, significant falls, maybe allergic reaction, chest pain, burns, a little bit more serious than I think a lot of urgent cares are going to be comfortable with. And let me tell you this stat. Urgent cares tend to be staffed 85% of the time by mid-levels or physician assistants or nurse practitioners. When we're going to the next level now, we're talking about physicians such as myself, an emergency physician on staff every minute we're open. So we have signs like this. You go to the web, like urgent care versus ER, strains, rash, cold or flu. Yeah, urgent care. Heart attack, chest pain. No. That's really critical. These are critical stuff, but stroke and heart attack should go right to the emergency department. However, a 35-year-old guy may have bumped his chest and has chest pain, or maybe he thinks he broke a rib, then come to us, the advanced urgent care. You don't need to go to the hospital, and broken bones included, unless it's open fracture where the bone is sticking out of the skin. That needs to go to the emergency department. So there's some billboards on this stuff, like you see, stepped on a mousetrap, urgent care can handle it, get your toe fixed. But if you stepped on a bear trap, you probably need the emergency department, right? So you take the emergency department. We got a bunch of them in the Atlantic Health System. We have Chilton, we have Morristown Medical Center, Overlook. I'm going to forget a couple, but Central State and Newton Hospital in Hackettstown. There's a picture of Chilton. This is Morristown, and it's just constantly growing. It seems like all of them are growing. And this is the Children's Hospital, which is a designated children's hospital for several counties connected to Morristown Medical Center. And that's the lobby of Gorham Children's Hospital. Now, emergency departments, we're 24-hour operations, 7 days a week, 365 days a year. Life and limb-threatening things, significant trauma, complex lacerations that are going to need possibly plastic surgery or a lot of work to get them straightened out. Altered mental status, could be a stroke, right? Seizures, severe abdominal pain, syncope. Well, actually, and that can be taken care of in the new AdvancED urgent cares, but we'll talk about that in a minute. But trust your gut. If you really think it needs rapid assessment, or you may think you may need surgery for that broken bone, like a broken hip, a fever without a rash, going to need some significant blood work, seizures, severe cuts that require some revision of the wound, straightening out the edges from making ragged to smooth. Severe cold flu symptoms, like you really think you're hypoxic, you're short of oxygen, you probably should need to go to the emergency department. Trust your intuition, the bottom bullet there. But we're all learning about this and what the capabilities of these different urgent cares are. Once again, can you safely drive if you're taking care of somebody else or yourself? A lot of people try to drive themselves and it doesn't work out sometimes. You always call 911 if you don't feel quite safe. So how do you think about this ahead of time? How do you prepare for an unexpected emergency? Well, you're doing it right now. By talking with us and you submit questions, it's not an oxymoron because you're going to think about this and go, geez, if I have an ankle sprain, I can go there. But if I have chest pain, well, I don't think it's a heart attack. I just want to get checked. You have options besides the emergency department. This is just a joke slide saying this sign says illiterate, write for free help. Well, how can you write for help if you're illiterate? It's hard to tell if these dad jokes get across the web, but so how do you prepare for an unexpected medical encounter? You make plans ahead of time. You talk to your primary care physician. Hey, where should I go when Johnny gets a fever? And where should I go when my mom gets a fever or falls? So these are your go-to resources, and you're going to have a list of the medications, the dosage. Even though we have sophisticated electronic medical records that we can check on, it's good to have a list. A lot of people do this for their parents and loved ones. And it also lists the prior medical procedures or surgeries. Again, with the advent now of electronic medical records, I could click and type in, and I could see a lot about you. And it's really neat. And it's making things a lot more efficient and safe for everybody. So let's talk about the brand new, fantastic option we're here tonight for, the AdvancED urgent cares. This is a brochure we created last year in Atlantic, and it breaks down the upper left, your pediatrician or family medicine for a kid, for like appointments and routine medical care and sick visits, urgent care for some more significant stuff, but walk-in, no appointments. The problem with no appointments are sometimes you have to wait, but they're available, they're open. The advanced urgent care, the third block down, is what we're going to talk about next, and we're open 7 days a week, 365 days a year, and we'll tell you about the hours. And then the next level down up would be the hospital emergency department. And just so you're clear, the advanced ED urgent cares are much closer to an emergency department than they are to an urgent care because of the staffing and the facilities I'm going to tell you about right now. So once again, where do you go for care? Well, urgent care, you can call in advance. People take electronic appointments. We're working towards that, but no, you just walk in and you can call ahead and say, hey, how's it looking? Oh my God, a bus just unloaded. So give it an hour to cool down and then you show up. But usually we get everybody in. And advanced ED urgent care, just so you're clear, 0 to 106 plus. You know, we take care of all ages. This, don't read it. This is a back of a brochure that Ms. Lusick is going to send to you or make available to you. It lists all the emergency departments in Atlantic Health, all the urgent cares, and all the advanced urgent cares. And I blow it up here just so you can see it, but you can see on them Atlantic Advanced ED Urgent Care on the left. I'm going to blow that up now, but there is a QR code, and everything I just showed you is going to come up if you scan that QR code. And this is the new brochure, and this is what we're going to highlight right now. No appointments, 7 days a week, holidays, CAT scan, X-ray lab. And these are the locations. I'll show you that, go through them with you right now. Bayonne, Clark, Mountain Lakes, and Paramus. I'm going to show you Google Maps. All these sites have advanced technology, and that means EKG machines, CT scans, on-site laboratories, so we can send labs and run them. If we can't run them, we send them to a core lab, and they'll be back the next day or the day after that. Walk-in convenience, we still don't do appointments. We think you can't plan an emergency, so we acknowledge that, and these are walk-ins. And we try to give you a warm handoff, it's called. I try to make sure if you have a broken bone, you have an orthopedist to follow up with the next day or on Monday if it's a Friday. So we try to help you navigate the healthcare system. And of course, because it's an Atlantic facility, they only have like movie star good looks type staff, as you could see, like George Clooney, the star from ER. That's a criteria to get to human resources in Atlantic, except for my case. So we have emergency nurses, we have emergency physicians, emergency nurse practitioners, PAs, but the PAs and nurse practitioners are working alongside an emergency physician every minute we're open. We have radiology and CT technicians because we have to run the CAT scan and x-rays. We have lab technicians who run CBC, cell blood counts, chemistry profiles. And we have medical assistants that are going to help coordinate your care there, make you comfortable. This is the Mountain Lakes. This is the first one that was opened about 4 years ago. And we say, well, where's that? There's trees in front of it. Well, it's right across from, that's the awning when you drive by in the parking lot. But it's right across from Paul's Diner right there in Denville/Mountain Lakes. And when I tell people it's by Paul's Diner, they go, oh, yeah, I know where that is. This is the new one in Paramus, opened about a little over a year and a half ago. And it's in a big box, we call it. It's got physical therapy in there, X-ray suite, CT, and there's an MRI. If you're prior authorized for an MRI, they could do it in that building. And it's in Paramus. And you know where this one is? I always go geography again. It's by Stu Leonard's. Everyone knows where Stu Leonard's is. So these are equal to each other. Paramus and Stu, Advanced Urgent Care and Stu Leonard's. And there's one of our newer ones. This is Clark. This is down off the Garden State Parkway. It's 78. You can see on my cursor here. It's right off the Westfield exit. Same thing. Diagnostic center, lab, and then they have the advanced ED urgent care as of about 9 months ago. And the newest site is Bayonne. Don't go across that bridge. You'll get in Staten Island. You'll be charged $16. So we're north of the Staten Island, that Bayonne bridge. We're right down there, downtown Bayonne. Lovely site. Advanced CT scan is going to be up and running very shortly. X-ray is already running. We have some lab capabilities, and that's being expanded every week. So let's take a tour. This is what a nurse's station looks like. Clean. This is Atlantic facilities. I just love the way they build clean facilities. This is the labs, highly technical. No need for you to worry about that. And this is the coup de grace. This is the big deal. This is the CAT scan. So we can do really involved workups for abdominal pain, chest pain, rule out pulmonary emboli, rule out appendicitis, can exclude diverticulitis, look for abscesses, look for a lot of dangerous conditions. That's one of our chief medical officers. He's a CEO of the medical practice, Dr. Schreck, and that's his proud face because he's really proud that we're building these practices with all these capabilities. So again, advanced technology, on-site lab, walk in, and coordinate follow-up care. These are some examples of when to go. Chest pain. You've never had a heart attack. You don't think you are, But if you have had a heart attack and it feels just like the big one you had once before, you got to go to the hospital. But if you don't have that kind of history, come by and see us. Broken bone. If we could stabilize it, we could X-ray it and stabilize it. Fever in adults. Granny who's 80 with a fever, we could take a look at her and treat her. We could give IV antibiotics and start the treatment just like they would in the hospital. And then we can bring her in the next day for more IV antibiotics if that's indicated. You could bring a child in, a small baby, even with a fever. We could take, I'm a pediatric emergency physician. We're trying to make sure that everyone's comfortable that taking care of these little churubs. Shortness of breath, lacerations we fix, abdominal pain. I just told you that. Head trauma, you fall and hit your head. If you're over 65, you need a head CT when you hit your head significantly, even if you feel fine. If you're on a blood thinner and hit your head, you need a CAT scan. We can do that. You don't have to go to the emergency department to get that service. So if you fall down a couple steps, thump, okay, you urgent care. No, you go thump, thump, thump like down a whole flight. We can still take care of you. You think you go to the emergency department, but we can actually take care of it. If you're able to get up and just say, boy, I think I may have broken that or that, but you're ambulatory. Come on in. You stepped on a bee, urgent care. You stepped on a beehive, you have multiple stings. We can treat anaphylaxis at these advanced ED urgent cares. So if your airway isn't closing, if your airway is closing, go to the hospital. If it's not closing and you feel a little sweaty or a little nauseous or you're getting a rash, if you can get to us quickly, we have epinephrine, we can take care of you. And this is a big deal. I'm wrapping up here very shortly. It's access. You need care now. Walk in. No appointments. It's one stop for so many things. I can't even cover them in 5 hours. No referral. I could do CAT scan without prior authorization. We have 8 to 8, 8 to 5 on weekends, holidays. So, we're available. It's affordable. What you didn't realize, so I'm just going to tell you now, it's a bundled rate. In other words, a level 3 is this rate. A level 4 is a bigger rate because we did x-rays and more tests. Level 5, we have to just make a decision whether to go to the hospital or not. That's going to be a bigger global bill. But it's still a fraction of what it would cost to go to the emergency department where you have professional fees, technical fees, and this fee and that fee. So it's very attractive. If you're a Medicare patient, they won't let us do that. They have to submit the bills the normal way. But Medicare is a very good and thorough carrier, so usually it's not an issue. Once again, global rates. We're talking quality care, emergency department level care, but good value, great value. That's why I put in green. Now, if you're having a stroke, slurred speech, weakness on one side of your body, something like that, go to the heart, bypass, go. You're going right to the ED. If you have probable heart attack, probable, not chest pain, because you hit your chest, you have a cough, and it could be a virus or pneumonia. We take care of pneumonia, by the way. If you have a tracheostomy, false airway, high-tech medical devices, complications, you probably need to go to the medical centers so they can handle that. Here are the hours. Once again, sometimes we cover for your doctors. We tell them, hey, turn your answering service on to us. Send them to us, and we'll take care of your sick patients when you're gone. These are the numbers. Ms. Lucic is going to send this presentation out to you, and you're going to have, those are the numbers for the 4 advanced urgent cares. And there's more coming. There are more coming, but I can't disclose where yet because I can't, but there are more coming. And, okay. So once again, the brochure you'll get, this is like one of the original ads, Advanced Urgent Care, Diagnostics, Technology, Treatment, and Physicians and Staff. You don't want to see this. I did a webinar, a community conversation. You'll get the link for that. That's 17 minutes, and it's a question answer format that some people found informative. So you can pick that up. Devin Booth, Dr. Booth is not on this webinar right now, but she's the head of the Atlantic Medical Group Urgent Care Practice, whereas I'm in charge of the medical staff for these advanced urgent cares. So from that, I will take questions if there are any in the chat room.
So I would like to say thank you to everyone for joining us tonight. We kindly ask that you take a few minutes after tonight's webinar to complete the survey. The link to the survey has been added to the chat for your convenience. A special thank you to Dr. Girardi for dedicating your time and expertise this evening. If anyone has any additional questions or comments, you can send an email to communityhealth@atlantichealth.org or call 1-844-472-8499. And with that, that concludes tonight's webinar, and I hope you all have a great night.
and weekend. Take care.
Thank you, you too. Bye-bye.